Hello, my name is Benjamin C.
And I'm Chris Ship.
We're here to present a presentation on euthanasia and physician-assisted suicide. We will be uploading our PowerPoint separately because I couldn't get it to work on my computer, sorry. Technical issues and all that, okay. To define euthanasia is the painless killing of a patient diagnosed with a terminal and/or chronic illness. When traced back to its language root, it can be translated as good death because this is what it sets out to do. It sets out to be a painless and alternative way to die when you're suffering from chronic or mental illness. It has been practiced since ancient Greece and Rome and has improved as we've learned more about the body. Today it's done via narcotics and other things like that. More on that later. It sets out to be a merciful death, a painless one where for those that are suffering with chronic mental or physical illness like cancer or dementia, something that where if their quality of life would not be good after treatment, they have the option of ending their life if they choose to.
Euthanasia has been a hotly debated topic in the fields of ethics, religion, law, and spirituality. So, basically for the past 100 years especially, it's been, people have really been discussing it. It brings up questions like, is it right to put someone out of their misery if they're suffering? And if someone's going to die regardless of what we do, shouldn't we give them control of how they die? Currently, euthanasia is illegal in 41 states, including Idaho. It is also legal in a majority of countries, the exceptions being Belgium, Netherlands, Canada, Luxembourg, Spain, and some parts of Australia. Euthanasia is always done with the consent of the patient and occasionally the consent of the patient's loved ones in cases where the patient is unable to consent due to illness like long-term dementia or a comatose state. Yeah. In countries where it has been made legal, there are restrictions regarding who can receive it, limiting it to those with chronic or terminal illness. Before anyone is able to receive it, a board of physicians is required to review the patient's circumstances and their potential for full recovery after treatment. If there is no hope for recovery or quality of life after treatment, then the board would allow the option of euthanasia.
So euthanasia today has definitely improved since ancient Greece and Rome. Today it's performed via lethal injection of a narcotic, which usually follows a sleeping drug and a painkiller to basically put the patient to sleep before their heart stops. The process is always consensual, and the patient can choose to refuse euthanasia up to when the needle is put into their skin. Occasionally, the patient themselves will take the drugs themselves. The doctor will provide them, and the patient will be the one to administer themselves the shot. The physicians are under no legal right or restriction to be required to perform it. It's always up to them whether or not they choose to do this, and if they choose to do so, they're required to file reports on every patient they euthanize and provide information about the circumstances of their illness and their circumstances surrounding their life quality, possibly after this.
Financially speaking, euthanasia is better for the people paying for the treatment. According to the CDC, 1.7 million people are diagnosed with cancer every year, and of those, 600,000 of those cases are terminal. Treatment for illnesses can cost up to $45,000 to $50,000 per treatment, and that doesn't even include hospital stay, prescription costs, or even doctor visits. Programs like Medicaid and Medicare only cover some of these costs, leaving more than half of the total bill to the patient or on their dependents. This can cost up to $35,000, which will have to come from either private insurance or out of pocket. Comparatively, treatment for euthanasia costs between $20,000 to $25,000, an incredible markdown from the $45,000 to $50,000 per treatment, not including hospice and prescription costs. It is estimated that 33% of costs of the average person medical expenses occur in the last month of life.
Yeah. So, as we've said before, it's very financially straining, and if you're worried about this being a new system or anything like that, it has been proven to be successful in other countries. In Belgium, euthanasia has been legal to practice since 2002. That's as long as I've been alive. They have set up the system that they have set up in Belgium and in countries like unto it has been proven to be effective and ethical. Minors under the age of 12 are forbidden from receiving in any way, shape, or form. It is illegal to do so. And from the ages of 12 to 19, both parents' consent is necessary. In addition, a person's case must be reviewed by a panel of doctors to determine whether or not the patient has a chance of recovery. If they do, then they're not allowed to receive it. The number of people Now, truth be told, the number of people who have accepted euthanasia in Belgium has steadily increased over the years, from a total of 24 people to the year 2002 to a total of 2,444 people in 2020. However, this accounts for only 4.6% of the total number of deaths recorded that year. So that's only 4.6% of every death occurring in Belgium. This includes traffic accidents. This includes various traffic accidents, old age, just various other things like that. Of the patients who chose euthanasia, 93% of them consulted with a physician first to get familiar with the process and understand it. And of those patients who chose it, 77% of the patients were 65 and older, and 55% were diagnosed with some form of cancer. So a good majority of these people who chose euthanasia were suffering from cancer and other long-term illnesses, meaning that this would be a merciful way to let them go.
So a lot of opinions and questions. The United States opinion on euthanasia has barely changed in the last 18 years, fluctuating from the 46th to 52nd percentile in support of it. As of 2017, 1.5% of people in Switzerland were euthanized and 88% of people supported it. The question euthanasia, the heart of the matter, is this: should we let a person continue their life if they are suffering? If we save their life, would it be worth living? If a patient is in pain that's chronic and incurable and wants to die, should we really prevent them from doing so, or should they stop that? We are not encouraging suicide or self-harm by supporting this argument. We are simply advocating for clinical and professional euthanasia done by professional healthcare providers as a result of a chronic or terminal disease with little hope for long-term treatment or care.
Okay. Our sources are going to be listed in our presentation. We hope you enjoyed it, and we hope that that this presentation was informative. We hope that you will learn and understand that this issue is one that's serious and could be easily implemented in the United States. We thank you for your time.